Magandang araw po mga kasambahay and welcome to another very special episode of your favorite multi-award winning health and medical program. Ito po ang Doctors on TV. My name is Dr. J.M. Ko. I'm an internist and an endocrinologist. Joining me today, Dr. Lady Groovy Tagulao.
Hi, Doc. Nice to see you again.
Hello. Very good to see you,
And
Doc
also,
Lady.
we are in a very beautiful place. Parang wala tayo sa hospital.
Yes.
But now, mga kasambahay, nandito pa kami sa De Los Santos Medical Center here in Quezon City.
Oh, truly, ang daming advancements na in technology here in De Los Santos Medical Center. Very impressive ang facilities.
Tama ka dyan, Doc. And bago po tayo mag-upisa, no, gusto namin batiin a special mention ng Tawi-Tawi Medical Center.
Yeah, thank you for supporting us and joining us every week. Also, hi to Miss Yas Moralia. Hello, Miss Yas. We miss you. Sana you could be here with us.
Yes, we miss you. And hi nga pala sa aking mga kapamilya dyan sa Zambales, Sevilla, and Abrigo family.
Okay. Before we go on, I'd like to invite you to join us in our social networking sites. Please like us on facebook.com/DoctorsOnTV. Follow us on twitter.com/DoctorsOnTV. Watch us live streaming on the internet, UNTVweb.com, wherever you are in the world. Pati yung mga past episodes namin naka-upload doon. Have a very interesting topic for today. Okay, we shall be talking about psoriasis. Okay.
Exactly. May mga iba tao kasi parang hindi nila alam kung what is psoriasis. So they have a lot of misconceptions about it. So hopefully itong episode namin ngayon mabigyan sila ng kaliwanagan. No? Ayan.
Before we invite our special guest, panoorin muna natin ang video na ito.
Ang psoriasis ay isang uri ng lifelong skin disorder kung saan makikitang magbubutlig-butlig, mangangati at mamumula ang balat. Kadalasang nagsisimula ang infection sa ulo. Nagkakaroon ng makakapal na balakubak patungo sa ibabang bahagi ng katawan. Ayon sa mga eksperto, isa ito sa pinakakaraniwang uri ng autoimmune disease sa buong mundo. Sa talaan ng International Federation of Psoriasis Associations, apektado ng psoriasis ang halos 3% ng populasyon ng mundo. Nahahati sa 3 kategorya ang psoriasis ayon sa National Psoriasis Foundation. Ito ay ang mild psoriasis, moderate at severe. 50% ng may severe case psoriasis ay nagiging psoriatic arthritis. Ano-ano nga ba ang mga epektibong paraan at payo ng mga eksperto kaugnay ng tamang management at flare-up control ng psoriasis? Alamin, dito lamang sa Doctors on TV.
At yan po mga kasambahay, ang topic natin for today, psoriasis. To help us understand, we've invited an expert. She is board certified in the Philippine Dermatological Society, currently practices as a dermatologist here at the De Los Santos Medical Center, Dr. Lily Lairalin Laconico Tumalan. Hello, Dr.
Hello.
Thank you for joining.
Magandang araw.
So, Doctor, what does it mean to be board certified by the Philippine Dermatological Society?
Well, actually, we underwent a 3-year residency program, and then after which we take a board exam. No? So when you pass that board exam, you're a board certified dermatologist of the Philippine Dermatological Society.
Okay, so you have to take an exam, a certifying exam.
Certifying exam.
Okay. And people, when they hear about dermatologists, they generally think pampaganda, beauty. But there's more to being a dermatologist than just aesthetics, no?
Yes, actually, we are experts also in the pathological aspect of dermatology. No?
So when you say pathological, ibig sabihin yun, kumbaga sa mga kasambahay natin, explain na hindi lang pampabeauty, kundi ito yung mga hindi natin kanais-nais na nakikita sa mga balat. Usually yun naman nagpupunta sa'yo.
Usually may mga health concerns, no? Yung may mga, syempre kakaibang lumalabas sa balat nila. Ito usually yung minamanage ng patients on their own, no? Minsan nagpapahid na sila. Kaya lang kapag hindi nawawala, they really go to the experts, no, who are the dermatologists.
Up next, our skincare expert will give us tips on how to avoid a contagious skin disease called water warts in Skin Link, while expert will let us learn the red flags of psoriasis. When Doctors on TV returns.
Hello mga kasambahay! Ako po si Dr. Casey Reyes for another episode of Skin Link. Ang topic po natin ngayon is molluscum contagiosum. So, ang molluscum contagiosum po is a virus that affects mostly children. Usually po yung mga around 1 to 10 years old. Kaya po mga bata usually naapektuhan dahil mas mababa po yung immunity ng mga bata compared to the adults. So, ang itsura po niya is para siyang papule. Pwede po siya maging white, colorless, pink, or brown. Usually po round with 1 to 6 mm yung diameter. And makikita po nyo, mukha po siyang shiny. Tapos umbilicated para pong merong pit sa gitna. And minsan po, kapag in-express nyo tong pit na to, magkakaroon po ng cheesy material na lalabas. Pero pag nagkaganon po, pag ginawa nyo yun, pwede pong magkaroon ng auto-inoculation, pwede po mag-spread yung molluscum contagiosum or yung mollusca, mas maggagawa po siya ng isang row. Kaya better po pag may ganyan, hindi po natin i-express yung laman. Usually po nakukuha to via direct skin-to-skin contact. And pwede din po siya ng indirect skin contact. Halimbawa po, nag-share po tayo ng towels. And then pwede din po siya sa auto-inoculation. Halimbawa, nag-shave po tayo. Ang mangyayari po is yung virus pupunta sa ibang lugar. Or pag sinascratch po natin yung area, pwede po siyang pumunta sa lugar kung saan natin sinascratch yung ibang part ng skin. And pwede din po siya makuha by sexual transmission. Mas rumarami siya kapag sa tubig nakukuha. Common po siya kapag yung mga bata magkasama nagsiswimming sa tubig, tas yung tubig hindi masyado chlorinated or hindi enough yung chlorine na nalagay. So, that's why it's very common during summer months. Usually po makikita to sa parts na medyo yung moist na area ng parts ng body natin or yung tendency na magkaroon ng mas maraming moisture like sa underarm, and then pwede din po sa genitals, pero it can appear in any part of our body. So for treatment naman po, we don't have a medicine that will kill the virus, the pox virus. So ang ginagawa po natin is supportive treatment na lang. So what we do, we can use cryotherapy or freezing para ma-freeze yung molluscum. Pwede din po tayong gumamit ng curettage or ng electrocautery or ng laser. Pero ito po mga to, pwede pong may possibility mag-scar yung molluscum. Pwede din po tayong gumamit ng imiquimod cream, which is an immunomodulator. But this one, hindi pa po siya proven. But it's usually the medicine that is given by your doctor. And then also, we can also use cleaning solutions like povidone iodine or hydrogen peroxide to clean the area. So sana po marami po kayong natutunan sa episode po natin ngayon sa Skin Link. Ako po muli si Dr. Casey Reyes. And if you have other questions, you can contact me here at Luminis Clinic. Our contact number is at 02511-8500 or at 0915-979-4661. You can also check out our website at www.luminis.com or Facebook page at Luminis or Instagram page at Luminis_official. Hanggang sa muli po, magkita-kita ulit tayo. Maraming pong salamat.
At nagbabalik mga kasambahay ang Doctors on TV. And today, we're still here at the De Los Santos Medical Center. Kasama pa rin natin ang dermatologist from the section of dermatology, Dr. Lily Lyralyn Tumalan. Hello, Dr.
Hello! Hi, Doc.
Hi.
Yes. Napakaganda ang topic natin ngayon. So, si Dr. tutulungan niya tayo and our viewers para ma-explain niya maigi kung ano ang psoriasis.
So, Doktor, ano ba ang psoriasis? Bakit nagkakaroon ng ganito? Marami bang sa Philippines may ganitong sakit?
Actually, to answer your first question, what is psoriasis? Well, psoriasis is a chronic inflammatory skin disorder. Kung ilan yung affected, worldwide, about 1 to 3% of the population.
Klase sa Pilipinas, Doc?
Sa Philippines kasi we don't have really an exact data, no? Pero ganun din, more or less it's about 1 to 2% of the population yung affected.
So sa clinic niyo, marami kayong mga na-encounter na Filipino patients?
Yes, actually it's one of the most common diseases that we see. Mga 1 to 2 million, yeah. Yun yung parang numbers that we see right now.
Okay. Ano ba nangyayari sa isang patient na may psoriasis na parang?
Okay. So, siguro to explain your question, no, we'll start with the normal skin.
Okay.
No, in the normal skin kasi, we have different layers. No? The top layer of the skin is our epidermis. No? Ito yon. And then we have the dermis and the subcutaneous layer, which is composed of our fat. Sa normal skin, normally, nag-shed off yun every so often, usually about 21 to 28 days. So yung lowest layer ng epidermis natin, nagpo-form ng new cells, so umaakyat yan. And then, in about 1 month, nag-shed off yung old cells. Pero in a patient with psoriasis, what happens is, nagmo-multiply faster than the usual yung skin cells. So meaning, instead of 21 to 28 days, in about 3 to 5 days pa lang, nagkakaroon na ulit siya ng bagong set of skin cells. So yung galing sa lower layer ng epidermis, mabilis na umaakyat. Kaya makikita nyo dito sa picture, mas makapal na ngayon. So mas mabilis yung pagdami ng skin cells. And eventually, nagkakaroon ng scales. Yung makikita nyo, kasi umiipon-ipon yung dead skin So kumakapal yung skin, at the same time, naiipon yung scales. Yun yung nakikita nating thick, red, plaques na may scales on top doon sa patient natin.
Pero usually, paano nagkakaroon ng ganito ang mga pasyente?
Actually, yung mechanism, it's a very complex interaction. No? To make it simple, based on studies, what they found out is that there's an immune dysregulation among patients with psoriasis. So meaning, yung immune system nila, mas nag-overreact. Yung tinatawag nating T cells, yung T cells dumadami, causing the inflammatory reaction and eventually causing this hyperproliferation ng skin cells, mabilis na pagdami. And actually madami pa, including yung mga blood vessels in the skin, kasama lahat yun. It's a complex interplay actually of chemicals, cytokines, lahat ng meron dun sa balat natin.
Ano ba yung mga risk factors for a person to get psoriasis?
Risk factors, actually, they found out there's a very strong genetic basis. So, nakita nila genetic siya.
So
meaning there
are a family member na may psoriasis?
Yes. Actually, if both your parents have psoriasis, you have around 41% chance of getting it. If only one of your parents have, you have around 14%. And if one of your siblings has psoriasis, mga 6%. So about that time. So, meaning, proven na yon na it's genetically passed on. Although, it doesn't mean if your parents or other relatives have psoriasis, eventually magde-develop ka.
Oh.
So, sinasabi nga nila, it's a genetic plus environmental risk trigger. So, meaning dapat nandun yun both. May mga nakita na sila talagang genes, wherein like yung HLA-CW6, nandun yung psoriasis na gene,
Meron bang mga predisposed dito at a certain age or sex?
Yeah. When it comes to age, actually, any age naman can be affected. Although rare siya sa infants, yung pinaka-common is they find it sa mga mid-20s, nasa 15 to 30 years old, yung commonly affected. But pwede rin kahit 50s to 60s, they can also have psoriasis.
So, Doktora, nabanggit nyo na kanina, mga certain genetic predisposition. May mga triggers pa po ito para lumabas at a certain age.
Yeah. Actually, yung triggers, medyo marami rin sila. Number one, pwedeng infection, May type ng psoriasis na lumalabas after an infection, an episode of infection, that's one. Pwede ring stress. Actually, based on studies, yung psychological stress, malaking factor ang stress. Actually, madami akong patients na nakakausap. Doktora, ang napansin ko lang nag-trigger nito yung emotional stress. So, that's two. Actually, may certain drugs na nakaka-trigger nito, like our beta blockers, yung gamot natin for hypertension, pwede rin yun. Yung mga antimalarials can also trigger psoriasis. Yung kebnerization, yung injury or trauma to the skin can also cause formation of the new lesions. Yung mga, minsan na sunburn sila, so parang trauma yun. Pwedeng maging trigger yun nung pag-form ng psoriasis patient.
And it is a permanent condition. Once it's triggered, your immune system does permanent.
Yes, actually, yun yung, unfortunately, once you have psoriasis, it's lifetime. So far, up to this point, no, wala pang nakikitang cure. But don't worry, you can control the disease. So meaning, maho-control natin yung paglabas ng mga lesions o yung mga patsi-patsi nito.
To clarify, Doktora, nakakahawa ho ba ang psoriasis?
Yes, very good question. No? Lagi niya yung tinatanong sa akin. Hindi siya nakakahawa. No? Yun yung importante. It's not infectious. No? Huwag yung kung ano yung mga pasyente na may psoriasis.
Hindi siya contagious?
Hindi siya contagious, wala ho.
So, you don't have to avoid
You don't have to avoid them. Yes, yes.
Kasi marami nga yung mga ibahin na hindi nakakalam kung ano nga ba. Agad-agad iniisip nila, naku, dapat
Nakakahawa,
yatang
yes,
lumayo
natatakot
ako.
sila.
Na-discriminate tuloy
Yes,
sila.
don't
Lalo tuloy na
discriminate them.
stress at nagkaroon ng emotional stress yung mga ibang patients. Some patients are even afraid to go out sometimes.
Yes, yes.
No?
Actually, they go into depression sometimes.
Because of the negative feedback that people think, no? Okay. So, thank you, Dr. Tumalad.
Okay.
We had a very, very interesting conversation. Mga kasambahay, huwag muna kayong aalis. Magbabalik po ang Doctors on TV.
Magandang araw mga mommy at daddy. Ako po si Dr. Katrina Flor Cruz, isang pediatrician, at ito po ang Baby Talk. I-discuss po natin ang tungkol sa road at pedestrian safety. Kapag po tayo ay namamasyal o naglalakad sa daan kasama ang ating mga anak, ugaliin po natin na maglakad doon sa side ng street kung saan nakikita po natin ang pasalubong na sasakyan. Para po nakikita din po natin ang ating surroundings, huwag po tayong gagamit ng headphones o kaya ay magse-cellphone. Kapag po tayo ay tatawid, iwasan po natin manggaling sa pagitan ng dalawang nakaparadang sasakyan dahil tayo po ay hindi makikita ng mga parating na sasakyan. Sumunod po tayo sa batas trapiko. Kapag po ang ating pedestrian signal nagsasabing stop, huwag po tayong tatawid. Pag ito po ay nakago, doon lamang po tayo tumawid. Maging mabuting ehemplo po tayo sa ating mga anak pagdating sa pedestrian at sa road rules. Ayan po mga mommy at daddy. Iyan po ang ilan sa mga tips para sa pedestrian and road safety. Muli, ako po si Dr. Katrina Flor Cruz at ito po ang Baby Talk.
And welcome back mga kasambahay to Doctors on TV. We're still here at the De Los Santos Medical Center in Quezon City. Kasama pa rin natin ang dermatologist na si Dr. Tumalad. Also joining us, Mrs. Leonie Ramos, isang 63 years old na since 2009 na-diagnosed with psoriasis. So Dr. in your examination, what can you say about the stage of the psoriasis of Mrs. Ramos?
Well, actually, yung psoriasis, kasi yung psoriasis, there are different types, no? Yung kay nanay, it's a chronic plaque type of psoriasis. So, it's actually the most common that we see, no? About 90% of our patients are chronic plaque type.
So, yung mga lesions
yung kanya kasi, actually ito kasi, no, nagpahid na siya, meron siyang nilalagay, kaya medyo manipis ngayon.
Okay.
Although, yung chronic plaque type, talagang malalaki, yun yung tinatawag na plaque, no, na mapupula, no, makakapal, at saka may kaliskis, no, may scaling. So ito yung nakikita nating mga, yan, ganito. Actually, ito yung mga common sites. Elbows, no, knees, including the lower legs, common site yun, and the lower back. Hindi ho ba? Oo. So ito ho yung nakikita nating mapupula, di ba? Ang kapal ho, tingnan, tsaka may yung puting kaliskis, no? So, yan po yung typical appearance ho ng psoriatic lesion.
Kadalasan ito yung natotrauma.
Yes, yes, yun yung mga sites na natutrauma kasi yung elbows, yung knees, so yun yung yellow.
Dr. dito sa hairline.
Yes, scalp is also common site. Oo. Although face, luckily, it's usually spared. Kung meron man, konti-konti lang.
Although may lesion si Mrs. Ramos dito sa
Yeah, oo nga.
Sa
Meron
temple
siyang isa.
area. Okay.
Although yung scalp nga niya, before, no, na-mention niyo, dati ho, makapal siya. No? Parang dandruff na severe type. So, ganun ho usually. Pero pag psoriasis, it goes beyond the hairline. So ngayon, medyo na-control ni Mommy yung yung sa scalp niya. Kaya hindi ho
under
gano'n.
treatment kasi.
Oo. Well, yung mga naka-moisturizer siya. Very good.
So, Nanay Leonina, noong 2009, ano pong unang naramdaman ninyo o napansin ninyo nakakaiba sa balat ninyo?
Ano po mga dot-dot na pula.
Dot-dot lang.
Tapos po mga makalipas ng mga 2 weeks, medyo lumalaki na siya. Tsaka parang nagbabalat na siya.
Masakit ba yung mga nagbabalat na yan?
Pagka tinutuklap po, yung pinakagilid niya, parang pag tinuklap mo po yung langib niya, yung gilid niya may dugo, lalabas na dugo.
Dumudugo pa. Makati ba yung mga lesions?
Yung mga flex po ang Makati.
Makati.
Opo, yung mga ganyan, Makati yung mga ganyan, Makati po yung flex.
Paano naman naka-apekto sa buhay mo ang pagkakaroon ng
Ay, gusto ko
psoriasis?
na nga po. Siyempre, dadating may problema, tapos may ganito ka pa. Hindi naman nakakawalam ko po. Kaya lang, siyempre, nahiya ka sa tao. Minsan, nakaano nga po ako, jacket, kahit hindi dapat mag-jacket. Ganun lang po.
Ano ba yung may tutulong natin kay Ma'am Leonila?
Actually, for her case, nung in-examine ko siya earlier, more than 10% of her body surface area na yung affected. Meaning, medyo kalat na siya, no? Meron siya sa loob, meron din ho siya sa arms and including the legs. Ngayon, for her case, usually naman talaga all our patients with psoriasis, no, we advise yung topical, meaning yung mga pahid, including our corticosteroid creams and ointments. So, yun yung number one, una namin ibibigay. Pati yung moisturizers or emollients. Kaya lang, sa ganitong extensive na, no, sinabi ko nga more than 10%, may ino-offer kami like phototherapy. Okay, yung phototherapy, it's a light treatment, no, using artificial light na may certain specific wavelength. It comes in different forms. Actually, what we have here in the hospital is a cabinet type. No? So, yun, pwede natin siyang i-subject to phototherapy ng ganitong kaso.
So I think si Nanay Leonila, mamaya dadali natin dun sa may phototherapy treatment room ninyo, no? Ayan, para makita ng mga kasambahay kung anong mga ba ang mga madaling mga treatments na pwede namang gawin, di ba?
Kasi we don't like corticosteroids na long-term
Yes.
in large body surface areas.
Yes.
No?
Actually, we can give it for a certain period lang. But then the patients can't keep on applying it for a long time. May mga side effects yun.
So it's
And
good that there are newer therapies like phototherapy.
a lot of years na rin, no? But this is new in the hospital, so we offer it to our patients who are indicated yung phototherapy.
Any oral medications for psoriasis?
Meron din, no? Marami. Although yun nga, ina-assess muna namin those patients who really need the systemic medications. Because we know yung mga systemic medications, may certain side effects yun, no? So usually, wini-work up namin sila, yung liver nila, yung kidneys, kung walang ibang contraindications before we give them that. So, I think itong phototherapy would be helpful and at the same time, it's safer, no, compared to the oral medications.
In other fields, Doctora, there are new biologic agents that target immune cells.
Yes.
Ayan sa doktor, na pag-usapan natin kanina yung phototherapy na nabanggit nyo. Paano naman yung natural light, sunlight, na pwede sa mga patient na everyday nila pwedeng gawin sa bahay, and when's the best time?
Actually, ginagawa ngayon ng ibang patients, no? Pwede rin naman yung natural sunlight. Kaya lang we don't really advise it to do frequently. Kasi yung natural sunlight, kumbaga yung wavelength niya marami yon. Kasama na dun yung harmful effects ng sunlight, including increase na risk for skin cancer, yung premature aging, yun yung dangers no, if you expose yourself frequently under the sun. Kaya lang itong phototherapy, kinuha lang yung specific wavelength, no, na therapeutic with less side effects siya. So, mas maganda talaga yung phototherapy kasi kung ano lang yung kailangan ng patient para gumaling, yung kinuhang ilaw. No? So, mas specific lang.
Specific wavelength na therapeutic
yes.
na, without
And
the harmful one.
yes.
Okay. And we're lucky we have it here at the Del Santos Medical Center.
Yes.
Actually, mamaya we will have the opportunity to let Ma'am Leonie undergo phototherapy. O, yan po mga kasambahay ang aabangan nyo sa pagbabalik ng Doctors on TV.
Up next, the natural way of fast wound healing will be shared by the nutraceutical experts in Naturally Yours. Find out the latest treatment and psoriasis flare-ups prevention. All these and more when Doctors on TV returns.
Araw mga kasambahays. Ngayong araw na to, pag-uusapan natin kung paano natin alagaan yung ating mga sugat O kung magkasugat tayo, ano ang ating management? Ang sugat ay pwedeng pagmula ng infection at ang infection ay pwedeng maka-affect sa ating buong katawan. Kaya dapat alagaan natin. Paano ba natin ayusin kapag tayo nasugatan? Kapag tayo nagasugatan, nagkaroon ng hiwa, so kung saang parte ng ating katawan, siguraduhin natin first step would be, dapat you stop the bleeding. Ang pag-stop ng bleeding, mga kasambahays, dapat kumuha kayo ng malinis na cloth. Kung meron kayong gasa, meron kayong cotton, o malinis na textile o mga damit natin, ito ang gamitin natin para mag-stop ang bleeding. Kapag nag-stop na, then simulan na natin itong linisin. Number 2, kapag nag-stop na ito ng bleeding, kung may water kayo, free-flowing lang, as much as possible, may pressure. Another thing is, kapag hindi naman available at hindi ka sure sa tubig, boil ng tubig. Kapag nag-boil ang tubig, make sure na palamigin muna bago ito ilinis. Kapag malinis na ang ating sugat, ang third step natin, make sure na lalagyan natin ng antiseptic. Marami tayong antiseptic, but kung nasa bahay lang tayo, marami tayong makukuha sa kusina. Pinakagusto ko ay yung raw honey. Ang honey ay well-known na antibiotic, hindi lamang ito mahusay na inumin, pero mahusay din siyang panglagay dun sa wound. Napakataas ito sa amino acids, napakataas sa vitamins and minerals para mag-create ng lining sa ating skin so that mas mapabilis ang heal ng wound. Of course, number 3, ang malunggay. Alam niyo ba mga kasambahays na malunggay ay napakahusay na antiseptic din sa ating mga sugat? How do you do this? Number 1, pag kumuha kayo ng malunggay, linisin ito ng malinis na tubig. Make sure na ang tubig natin ay malinis na source. Then, ito ay dikdikin natin kung meron tayong mortar and pestle sa bahay, pwedeng dikdikin ito. Kung wala tayong mortar and pestle, gamitan nyo lang mga kasambahays ng sterile. Banlian ito ng mainit na tubig para malinis, gumamit ng platito, tapos dikdikin ninyo yung malunggay ng pinong-pino. Kapag nagkatas na ito, ready na itong intapal sa ating mga sugat. Itong tatlo lamang mga kasambahays ay enough na para hindi ma-infect yung ating mga wound. Sana may mga natutunan kayo sa araw na ito. Kita-kita ulit tayo sa susunod na linggo mga kasambahays. Ito lang ang Naturally Yours.
At nagbabalik mga kasambahay ang Doctors on TV. Ngayon naman, nandito tayo sa phototherapy unit sa second floor ng De Los Santos Medical Center in Quezon City. Alam mo, Doc Lady, very impressive ang facilities dito. Bagong-bago lahat, no? Oo nga, bago. Parang pag magkasakit ako, sana hindi naman. Oo. Parang gusto ko dito ako magpapacheck up sa De Los Santos. No?
Si Nanay Leonie, nasa loob siya kasama ni Doktora. Binibrief siya bago siya magpa-phototherapy na session. It will be, I think, her first.
Yes, our first session, and she's lucky she has the opportunity to undergo this therapeutic treatment for free. Thanks to De Los Santos Medical Center. Shall we go in? Okay. And now, ito na ang phototherapy machine. We're with Dr. Lyra. Parang malaki pala ang machine natin.
Oo nga. Well, actually, may iba-ibang types of machine. Pero this one, we call it the cabinet type.
Okay.
So, kasya yung patient dyan, tumayo yung patient sa loob.
So, papasok si Ma'am Leonie sa loob.
Yes, pag gagamutin na natin si Ma'am, no, she has to undress completely.
Okay.
Meaning, tatanggalin niya lahat ng suot niya. And then, papasok siya sa may gitna ng machine. And then, isasara na natin siya. Makikita ninyo, yung buong machine is covered with fluorescent lamps. No? So, dyan manggagaling yung light treatment natin.
So, Dr. si Mrs. Leonie, candidate for phototherapy kasi may psoriasis siya, no?
Yes.
Ano pa ba yung mga ibang indications for undergoing phototherapy treatment?
So, number 1 is psoriasis, no? One of the most common diseases that we subject to phototherapy. Pwede rin siya sa mga eczema, no? Yung mga atopic dermatitis patients natin na may extensive affectation sa whole body. For vitiligo patients, no? Pwede rin siya. Actually, marami. Lahat ng mga inflammatory skin conditions, no? Like, yung mga more specific, yung mga psoriasis rosacea, yung mga pleva that we call.
So, maraming conditions
marami,
pwede
no?
mag-benefit
yeah.
with phototherapy, not just psoriasis.
Not just psoriasis, yung mga skin lymphomas, pwede rin.
Doktor, ano naman yung mga contraindications? Sino naman yung mga hindi pwede mag-undergo ng procedure na ito?
So, yung mga hindi naman pwede, yung may mga light sensitivity, like yung mga lupus patients natin, of course, no, matitrigger yung condition nila. Also, yung mga sa cabinet type, yung mga patients na may hemodynamic instability, yung they can't stand for a long time, no? Baka or yung may mga personal history of melanoma. So, hindi yun pwedeng i-photo.
So I guess we can prepare Ma'am Leonie for this procedure. Susuot ba siya ng goggles?
Yes, actually, yun nga ho, naka-undress completely yung patient, pero she has to wear the goggles to protect her eyes.
Her eyes naman.
So, Ma'am Leonie, lalagay lang ho natin, ha?
And for how many minutes do we expect Ma'am Leonie to stay inside?
For the first session, it will take about a minute lang ho. No,
just 1 minute?
Yes,
Okay.
1 minute to
Mabilis
2
na
minutes.
mabilis.
But yun nga, eventually, as we increase the dose, we will also increase the time. So, tatagal siya eventually. It will range 1 up to 10 minutes na siguro yung pinakamatagal.
So ano may mga preparations na gagawin natin kay Ma'am Leonie? Ano yung mga advice natin sa start? Do they have to drink a lot of water? Ganyan.
For patients with thicker lesions, no, yung mas makakapal, we put mineral oil or any emollient before they subject themselves to the phototherapy. Pero other than that, wala naman, no, walang kailangan ipahid before the treatment.
So papasok na po tayo, Ma'am Leonie, ha? Okay.
Papatanggal na lang ho natin sa kanya yung suot.
So, Doktora, si nanay nakapasok na sa loob.
Yes, sa loob na siya. No?
Okay.
Na-ready na natin siya for the treatment.
Okay. And we just turn on the lights for 1 minute. Ganyan.
We will start it to. May computer tayo. Doon i-input yung dose. And
Okay.
then, nandun din yung duration of the treatment. Tapos, it will automatically start na.
Your treatment begins in 10 seconds. Please put on your goggles. Your treatment will take approximately 1 minute. Your primary treatment is completed. Please leave the cabinet.
Doktora, tapos na yung treatment ni Ma'am Leonie?
Yeah, after 1 minute, yung first session niya, so tapos na yung treatment, we will have her, we will ask her to dress now.
Okay, so we'll give her the opportunity.
Okay.
Okay, so Doktora, dito muna si patient. Kasapin muna natin si Doc Lady.
Ayan, so kumusta yung therapy session ni Ma'am Leonila?
Okay naman, no? She was able to tolerate the treatment. No? Wala naman siya masyadong naramdaman after.
Okay, very good.
Mabilis lang naman siya sa loob na Doktora.
Actually, it will take for the first session about 1 to 2 minutes lang.
Ang bilis naman, 1 to 2 minutes lang.
But eventually, in the succeeding sessions, pahaba ng pahaba.
Pahaba ng pahaba because we'll be increasing the dose.
Okay. For how long ba yung longest session?
Well, actually, for her case, no, for psoriasis, it would take about 20 to 25 sessions. Actually, it depends on how the patient responds to the treatment.
Gano'n ka ang interval nito, Doktora?
We can do it twice or as much as thrice or 4 times a week. Well, at least 1 day apart. So she can come kung thrice a week, Monday, Wednesday, Friday. So it depends on her schedule din, no, at the patient's convenience din.
Anything that she needs to watch out for? Side effects?
Actually, we advise them lang to avoid unnecessary extra sun exposure. So when they go out, protect themselves from the sun, no? Mag-sunblock, mag-long sleeves or umbrella. And then, we advise them to put yung regular moisturizers nila. And kung may mga other treatment modalities na in-advise yung dermatologist nila, just to continue them, no? As prescribed.
Is this an expensive procedure?
Actually, here in our hospital, it's very affordable, no?
Okay.
Kayang-kaya ng mga patients natin, no? At par siya with other hospitals, yung price.
Very good. So, pag gusto niyo malaman kung magkano ang gagastusin niyo, tawag lang kayo dito sa De Los Santos Medical Center at mag-inquire.
Okay. Thank you very much, Doktora.
Thank you.
Doktora, any final words sa audience po natin?
Psoriasis, it's a chronic inflammatory disease. Although wala siyang cure, no, may mga treatment modalities tayo na pwedeng i-offer sa patients. No? Kaya, most important thing is magpakonsulta sila sa PDS certified dermatologist nila. Kami yung mag-aalaga, no, kasi it's a chronic disease. No? Kailangan silang tutukan, no? Brief them about the treatment modalities that can be done for them, and eventually makokontrol yung disease nila.
So, Doktora, if kung gusto kan magpakonsulta sa'yo, how can they contact you?
Well, actually, I'm just here at the De Los Santos Medical Center. No, they can course with the phototherapy. They can course with the phototherapy center.
And Doktora, anyone you want to greet? Ho?
Well, I want to greet the De Los Santos family, no, all the doctors and staff, and also my husband, si Marco.
Okay. So mga kasambahay, wag muna kayong alis. Magbabalik pa po ang Doctors on TV. At nagbabalik mga kasambahay ang Doctors on TV. And we're coming to a close. Thank you for joining us for this past hour. Had a very productive episode.
Yes.
Ano bang take-home message mo, Doktora?
Katulad nga ng sabi ni Doktora, no, kailangan natin alalahanin na unang-una, ito ay hindi nakakahawa,
Yes.
ang psoriasis. And pangalawa, sabi nga ay malaki ang impact ng emotional stress.
Correct.
No?
Okay. And don't forget, it is a treatable condition.
Yes.
Although we cannot cure it, there are treatments from emollients to lotions to oral medications, later on injectables, and especially phototherapy.
Phototherapy, katulad nakita natin kanina, no?
Of course, we'd like to thank the Los Santos Medical Center for this generous opportunity for us to visit. Of course, to our guest, Dr. Lily Lyralyn Laconico Tumalad. Also like to thank the President and CEO, Mr. Raul Pagdanganan, as well as the Assistant Vice President of Marketing, Mr. Carlos Marcilius Funelas. For inquiries, you may call De Los Santos at 723-0041 or visit their website, delosantosmed.ph. Follow them at their Twitter and Instagram accounts, De Los Santos Medical Center Official.
I would also like to thank Tawi-Tawi Medical Center for always supporting us. And of course, we would like to thank Mr. Walter Co. of Creative Bakers for the nutritious Walter breads available nationwide in all leading supermarkets and SMs. Walter bread, all yummy, no tummy, the healthy bread on everyone's lips. And also to LRT Integrative Medical Care Clinic in Zambales and San Isidro House of Healing. And of course, Fiber C, the only natural vitamin C.
Okay, until next week mga kasambahay, be safe and stay healthy. Magkita po ulit tayo sa susunod na linggo dito lamang sa Doctors on TV.